Down syndrome continues to be the most common chromosomal disorder. According to the Center for Disease Control (CDC), about 6,000 babies are born with Down syndrome each year, which is about 1 in every 700 babies born. Down syndrome is a condition in which a child is born with an extra copy of their 21 chromosome, hence its other name trisomy 21. This causes mental and physical developmental delays and disabilities.
So Down syndrome is when there's an extra chromosome in the body. So the extra chromosome is what would cause all the different alterations in presentation of a child or a person with Down syndrome. When you see someone with Down syndrome, they typically don't look similar to you and I. So they have different changes that you can notice. It's generally there's a change in the size. They're usually shorter than normal. They have alterations in the eyes. The eyes would slant upward. They have reduced muscle tone. Some of them can function, high functioning, and so they function. There's alteration in their mental and physical capacities as well.
In all cases of reproduction, both parents pass their genes on to the child. These genes are carried in chromosomes. When the baby's cells develop, each cell is supposed to receive 28 pairs of chromosomes from 46 chromosomes total. Half of the chromosomes is from the mother and half are from the father. There are 3 types of Down syndrome which comprise of trisomy 21, translocation, and mosaic Down syndrome. People often can't tell the difference between each type without looking at the chromosomes because the physical features and the behaviors are similar. In Guyana, the most prevalent type of Down syndrome is trisomy. To date, the Ministry of Health continues to provide services for both parents and children where they can learn more about the disease and have equal opportunities to learning and playing. We will now hear from a parent who has been given the opportunity to partake in activities and care for her child through the Tolly Mareed Rehabilitation Center.
So diagnosis for kids with Down syndrome, especially in Guyana, is things have changed. Zachary's 5, so I will say that diagnosis now is different from it was 5 years ago. And so in saying that, it means the diagnosis 5 years ago is different from it was 10 years ago. But for Zachary, it was different. He was fortunate, or I was fortunate, to be able to have a healthcare provider who was very kind in doing that diagnosis. Not all parents benefit, in my experience, from our group that we have, that they have the same experiences. The healthcare provider was very kind. They had a social worker present, you had a midwife present, you had a gynecologist present. And so from the inception, you have a full support base, and I think that is what is needed for a mom, especially if you're a first-time mom, or a mom who's going to receive a diagnosis. So he was diagnosed by sticking of the tongue at birth. My experience with that diagnosis was very, very kind. Oftentimes what you will find is not the same thing. Based on your healthcare provider, imagine what needs to be done is to ensure that persons exercise a lot of sensitivity to parents, especially in Guyana, where information flow is not so much out there. And so it's important because parents after that go through the phase of acceptance, right? And in that process of acceptance, it means that you have to really accept you have a child, accept the responsibility, and what comes next after that. You have to make that decision, because as soon as you accept, it means that you're thinking about therapy. Fortunately, we've seen, again, a lot more advances in therapy in Guyana. I've seen a lot more than what was present, and in my experience talking to parents who have kids who are 30 years old, 25 years old, who have not had those experiences. You have had now, we have more physiotherapists, we have more speech therapists, as much, not enough, not sufficient, but they're there. Occupational therapy. I'm grateful to Tolly Mareed, for example. Tolly Mareed has been very, very helpful with speech, with walking, and I think importantly for parents with kids with Down syndrome is to start with early intervention. Now, I'd like to say kids with Down syndrome are on spectrum, because you have some kids who have mild Down syndrome, and then you have some with the extreme with the healthcare. So you want to be able to do that assessment. Tolly Mareed is like the best place to be able to do that, and being able to know where you're going forward from there.
While the causes of Down syndrome are unknown, there are cases where it can be a genetic condition, along with cases of older mothers are more likely to have a baby affected by Down syndrome than younger mothers. In other words, the prevalence of Down syndrome increases as the mother's age increases. To estimate the prevalence of Down syndrome, the number of pregnancies affected by this condition is compared to the total number of live births.
Even though the actual cause of Down syndrome is unknown, some of the causes, advanced maternal age would play a factor. Even though when we say advanced maternal age, these are mothers at an advanced age. However, this does not 100% mean that your child will have Down syndrome because you're of an advanced age, because we do have materials that support persons, mothers under 35 years of age that have children with Down syndrome. So the cause is not, it's not a fixed cause. There isn't a particular reason that someone is born with Down syndrome. The cause is still unknown, but these are just some of the factors that could cause Down syndrome. There are still some researches that are being done to see if environmental causes also affect that, but those have been inconclusive so far.
In addition, there are a few mechanisms that can be used to screen for Down syndrome.
Screening can be done for detection of Down syndrome, but the screening are not 100% accurate. So you can do ultrasounds, you can do blood tests to check on the alterations, and that would be a way. So once a child is born, generally you can tell because of the physical alterations that that child would have. You can see it in their facial structures, in their muscle tones, and as a child develops, some of these alterations become more pronounced.
Moreover, early detection for infants and children with Down syndrome can make a major difference in improving their quality of life. Each child with Down syndrome is unique, and treatment will depend on individual needs. In treating and caring for these needs, 3 therapies can be done. Physical therapy, also known as physiotherapy, has proven to be an essential part of the efficient management of children with Down syndrome through movement and exercise manual therapy. Some common issues that physiotherapists address are delayed developmental milestone, balance issues, and decreased strength. Occupational therapy helps Down syndrome patients to master skills for independence through self-care like feeding and dressing fine, and gross motor skills, school performance, play, and leisure activities. Speech therapy works on preverbal skills such as eye contact, turn, talking, and attention. The speech and language therapist will also work on early vocabulary and language concepts. This can help support the child's verbal and nonverbal communication, as well as their language and cognitive development. Further, the Tollimer Reid Rehabilitation Center does not only provide services for children with Down syndrome, but they also provide a comprehensive service that caters for pediatric disability patients, patients that have disabilities, and amputees. So if you or anyone you know have a disability, visit the Tollimer Reid Rehabilitation Center for further information.